felt a lump in your breast and wondered if it's okay? It's a bit like a mystery, right? Imagine this, you're checking, and there it is, a lump. Now, you're asking yourself, is this normal? Should I be worried? Get ready, because we're going to figure this out together. Have you or someone you know faced this mystery of finding a lump in the breast? What questions do you have about it? Share your stories, and let's chat about it. Let's make a space where we share stories, learn new things, and support each other. Ever had a moment when you were scared, but it turned out okay? Or maybe you have advice for others who feel worried. Comment below. Once upon a time. Treatment side effects. Common chemotherapy and radiation therapy side effects include fatigue, nausea, and vomiting. Targeted therapy, immunotherapy, and hormone therapy have similar side effects, including gastrointestinal issues like constipation and diarrhea. People react differently to breast cancer treatments. If you're receiving treatment, ask your healthcare provider how treatment may affect you, including how it may affect your daily life. Also, ask your provider about palliative care. Palliative care helps manage breast cancer symptoms and treatment side effects so you're as comfortable as possible as you go through treatment. Doctor, what are complications of breast cancer surgery? All surgeries have potential complications, and breast cancer surgery is no exception. As you're considering your options, it's important to remember that surgery removes potentially life-threatening cancer. In general, the risks of breast cancer outweigh the complications. If you're having breast cancer surgery, potential complications, which may include infection at the surgical site, blood clots that can happen after surgery, nerve damage, lymphedema. Doctor, can breast cancer be prevented? You may not be able to prevent breast cancer, but you can reduce your risk of developing it. Just as important, regular self-exams and mammograms can help detect breast cancer early on, when it's easier to treat. Doctor, how can I lower my risk? There's no sure way to reduce breast cancer risk. Get to and stay at a healthy weight. This is a weight that's right for you. Eat a healthy diet. Some studies show a diet that includes vegetables, fruit, calcium-rich dairy foods, and lean protein may reduce your risk of breast cancer. Avoiding red meat and processed meat may also reduce your risk. Get moving. Studies show that regular physical activity lowers breast cancer risk. Avoid beverages containing alcohol. Research shows a link between breast cancer and alcohol. Get screened. Mammograms often detect tumors when they're too small to be felt. Do regular self-exams. Examining your breasts regularly helps to maintain breast health and may allow you to find breast cancer tumors. Some women have an increased risk for breast cancer because family members have it or they inherited a genetic mutation. If that's your situation, you may want to consider the following: genetic screening for breast cancer genes. Medication that may lower breast cancer risk like tamoxifen, raloxifene, or aromatase inhibitors. Prophylactic, preventive, mastectomy. Frequent breast cancer screenings and physical examinations. If you have an increased risk for breast cancer, you should have additional tests to detect breast cancer, particularly if you're under age 40 and have increased risk. What is the survival rate for breast cancer? Breast cancer survival rates vary based on several factors, like whether the cancer is invasive or non-invasive, the cancer type, and the cancer stage. The Institute organizes breast cancer survival rates by stages. Local, cancer hasn't spread outside your breast. Regional, cancer has spread to nearby lymph nodes and tissue. Distant, cancer is in more distant areas of your body like your liver or lungs. As you think about breast cancer survival rates, remember, they're only estimates based on other people's experiences. Cancer affects different people in different ways. If you have specific questions about cancer survival rates, talk to your healthcare provider. They're your best resource because they know your situation. Doctor, what's the outlook for breast cancer? Right now, more people are being diagnosed with early-stage breast cancer, meaning they're diagnosed when it's easier to treat, and fewer people are dying of breast cancer. Data shows 99% of people with early-stage breast cancer were alive 5 years after diagnosis. In some cases, they may be considered cured of breast cancer. But breast cancer can come back, and when it does, it may come back as metastatic breast cancer. Outlook may also depend on race. Doctor, how do I take care of myself? Living with breast cancer may not be easy. You may have days when you feel overwhelmed by your situation. Consider the following suggestions for taking care of yourself as you go through breast cancer diagnosis and treatment. Get enough rest. Breast cancer in treatment can be exhausting. Try to remember to rest when you need to, not just when you think you have time. Eat well. Treatment may affect your appetite. A diet of fruit, vegetables, lean protein and healthy grains can help you stay strong during treatment. Manage your stress. Cancer is stressful. Exercise can help, from regular walks to exercise programs. Find support. You're a breast cancer survivor, starting the day you were diagnosed. Ask your healthcare provider about cancer survivorship programs, which may help you manage some of the challenges that come with living with breast cancer. Doctor, when should I see you? Contact your provider if your symptoms seem to be getting worse or if you have new symptoms, like pain or weakness in a different part of your body. How long can you have breast cancer without knowing? You can have breast cancer for years before noticing changes in your breasts like a lump. That said, not all lumps or bumps are cancer. Check with a healthcare provider if you have an unusual bump or mass that doesn't go away after a few days. Can men get breast cancer? Yes, men can get breast cancer, but it's not common. Approximately 2,600 men develop male breast cancer every year in the United States, making up less than 1% of all cases. Transgender women are more likely to develop breast cancer compared to men. As Angela left the specialist's office that day, she carried with her a newfound strength. The road ahead was uncertain, but she felt supported and empowered to face the challenges that lay ahead. The specialist assured her that a dedicated team of healthcare professionals would be by her side every step of the way. Angela's journey had taken an unexpected turn, but within the challenges, she discovered resilience and a community of care that would shape her path towards healing. And so, the story of Angela unfolded, marked by courage, compassion, and the unwavering pursuit of hope in the face of adversity. Thanks to everyone who joined in on this important conversation. Your shared experiences and questions have created a supportive space where we can learn from each other. Remember, you're not alone in facing these uncertainties about breast health. If you found this discussion valuable and want to stay connected for more insights, tips, and support, consider subscribing to our community. Your subscription ensures you won't miss out on future discussions, and it helps us continue fostering a space where we can learn from one another. To those who bravely shared their stories, you're the heartbeat of this community. For anyone feeling a bit uncertain, know that this community is here for you. Subscribe, stay connected, and let's keep supporting each other on this journey.